Welcome back to my channel. If you're new here, my name is Neil Galvin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. If that is something that you are interested in, please make sure that you subscribe now. You hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, nurses, let's jump into the video. Hi everybody! Good morning! Isang panibagong Monday discussion nga ang ACLS sa inyo for today. The very first day of this week. And you can just imagine, malapit na ang Pasko, hindi ba? Ang saya-saya. Pero wala tayong pahinga dito sa ating channel because even though you're almost taking like Christmas is coming to town, I am going to provide you with another lecture for today, and this is going to help all of those nurses who are preparing or nursing students who are preparing to take the PNLE licensure examination by next year 2023. Because for today, like you see on the title, I'm going to provide you possible questions that you might encounter on the upcoming Philippine Nursing Licensure Examination. Yes, you heard it right. PNLE 2, Nursing Practice. Now, before I further proceed and before I give you the scope of today's examination, allow me to just please thank you who's listening right now, who's watching right now, for keep on supporting me on this channel, on my platform. Maraming salamat po talaga sa lahat ng sumusuporta at patuloy na nagsishare at nagla-like. Alam nyo, kapag sinishare nyo at nilalike nyo itong mga videos ko, nakakatulong kayo to promote the channel because words are really powerful. The power of social media. Kaya naman maraming salamat po sa lahat ng mga bago nating subscribers. Nako, thank you so much for subscribing and giving me your support and your trust. Thank you so much. Now, special announcement lang, kung hindi mo pa napapanood yung very first podcast episode, yung very first episode ko ng 3 a.m. Conversation with Neil Galvin, the podcast, I'll be actually putting the podcast link, my podcast channel, sa Spotify. Mo siya mapapakinggan exclusively on Spotify. Panoorin mo, ay pakinggan mo siya. And please do not forget to share me your thoughts and give the podcast channel like a rating because that will really help a lot for the channel to grow and share my podcast and a lot of downloads. Maraming salamat po ulit. And yun lang. Kung hindi mo pa napapanood yung other nursing educational videos I created on my channel, I'll be putting the nursing test banking playlist link on the description box, or whenever the icon button pops out, click the one out because I'll be including the actual playlist there, including some of the other nursing educational videos I have on my channel. Maraming salamat po ulit sa panonood ng mga lectures ko. Thank you so much. Now, without further ado, let's jump into the actual discussion. Now, the scope of the nursing test 2 is parallel to the NP2 National Nursing Licensure Examination coverage. What can you expect on the following on the questions? Well, some of the questions here will arise from the subjects such as maternal and child health nursing, community health nursing, communicable diseases, and integrated management of childhood illness. Puro pediatric nursing, community, and maternal and child. Okay? So, handa ka na ba? Handa na. Let's proceed. Let me share to you the objectives. We only have 2 objectives every time we do nursing test banking video. I'm going to provide and discuss to you board exam type of questions. The second one, and the most important one, I am going to provide rationalization for each board exam type of questions. If there's anything that I want you to take away out from this video, Every time that we do nursing test banking video, I want you to think and visualize as if you're taking the board exam. All right, that's your mindset. But in this case, it doesn't matter how high or low your score is. The main intention why we're doing this video is to actually for you to have the full grasp of the rationalization para kahit paikot-ikuting ka sa darating na exam, kawangis man to ng tanong o ito yung actual na tanong, is you know exactly how to approach the question, you know how to answer it, to attack it because you know by heart the rationalization. Okay? Yun lang, and let me share to you the instructions for today's examination. You will be given 10 board exam type of questions. I will be reading the questions and the answer and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each questions with rationalization. Choose the letter of the correct answer. Good luck, nurses. Hindi ko na patatagalin pa. Our very first question for today. Question number 1. A mother who gave birth to her second daughter is so concerned about her 2-year-old daughter. She tells the nurse, ito yung statement niya, I am afraid that my 2-year-old daughter may not accept her newly born sister. Now, here's the question. It is appropriate to the nurse to respond that, tinatanong ka, in short, appropriate response ng nurse towards the statement made by the mother of a 2-year-old daughter who's having a sister. All right. So A, the older daughter be given more responsibility and assure her that she is a big girl now and doesn't need mommy as much. Sige. B, the older daughter not have interaction with the baby at the hospital because she may harm her new sibling. Harm agad? C, the older daughter stay with her grandmother for a few days until the parents and new baby are settled at home. Or is it D? What's your proper response? The mother spend time alone with her older daughter when the baby is sleeping. Your 5 seconds starts now. Time is up, nurses. What is your right answer? Very good. Letter D. The mother spent time alone with her older daughter when the baby is sleeping. Now, here's the rationalization. Makinig, ha? The introduction of a baby into a family with one or more children challenges parents to promote acceptance of the baby by siblings. The parents' attitudes towards the arrival of the baby can set the stage for the other children's reaction. Spending time with the older siblings alone will also reassure them of their place in the family, even though the older daughter will have to eventually assume new positions within the family hierarchy. Alright? So, proper introduction nga po para maiwasan yung sibling rivalry at maging harmonious ang relationship. 2-year-old daughter to, mahirap pasunurin to kasi nasa toddler phase. Okay? Yun lang. Let's proceed. Question number 2. A 2-year-old client with cystic fibrosis is confined to bed and is not allowed to go to the playroom. Mapapansin mo sa mga tanong, karamihan ang atake natin, mga sets of questions na binibigay ko sa inyo is pediatric nursing. Milestone. What's this? Developmental milestone ng bata. Which of the following is an appropriate toy? Appropriate toy would the nurse select for the child? So, tinatanong ka, anong laruan ang ibibigay mo? What type of toy will you give to a 2-year-old client with cystic fibrosis? You were given like a medical condition of the kid. Is it A, puzzle? B, musical automobile or automobile? C, arranging stickers in the album. Arranging? Sige. D, pounding board and hammer. Your 5 seconds starts now. Time is up, you guys. What is your answer? Very good. Letter D, pounding board and hammer. Why? The autonomous toddler would be frustrated by being confined to B. The pounding board and hammer is developmentally appropriate and an excellent way for the toddler to release frustration. Period. Next question. Number 3, which of the following clients is at high risk for developmental problem? High risk for developmental problem. Alin sa mga sets of clients dito? Is it A toddler with acute glomerulonephritis on antihypertensive and antibiotics? B, a 5-year-old with asthma on cromolyn sodium? Or C, a preschooler with tonsillitis? Or D, a 2.5-year-old boy with cystic fibrosis? Your 5 seconds starts now. High risk for developmental problem. Time is up. What is your answer? Very good, nurses. You got it. Letter D. It is developmental task of an 18-month-old toddler to explore and learn about the environment, the respiratory complications associated with cystic fibrosis, which are present in almost all children with cystic fibrosis, could prevent this developmental task from occurring. Period. That is why the answer is letter D. Alright. Proceed na tayo. Board exam type of question number 4. Which of the following would be the best diversionary activity for the nurse to select for a 2 weeks hospitalized 3-year-old girl? Whenever you are come across with questions like this, we have age group, pay attention. 2 weeks hospitalized 3-year-old girl. You're given the situation of the client, 3-year-old girl. Ano daw ang most appropriate or best diversionary activity? Meaning, lahat ito ay was this appropriate for a 3-year-old girl. Nasa hospital for 2 weeks. Pero isa dyan ang pinaka-best. Is it A, crayons and coloring books? B, doll? C, xylophone toy? Or D, puzzles? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter C, xylophone toy. Now, the best diversion for a hospitalized child aged 2 to 3 years old would be anything that makes noise or makes a mess. Xylophone, which is certainly makes noise or make music, would be the best of choice. Alright? Next, last 6 questions na tayo, nangangalahati na tayo. A nurse is providing safety instructions to the parents of the 11-month-old child. Which of the following would the nurse includes in the instructions? Tandaan mo age group, 11-month-old child. Which includes which is the part of your instructions based from from these choices? Safety. That's the concept. Is it A, plugging all electrical outlets in the house? 11-month-old child. B, installing a gate at the top and bottom of any stairs in the home? Or C, purchasing an infant car seat as soon as possible? Or D, begin to teach the child not to place small objects in the mouth? 11-month-old child. Your 5 seconds starts now. Time is up, you guys. Now, let me read to you the answer. The answer to this question is letter B. Installing a gate at the top and bottom of any stairs in the home. Remember the age group, 11-month-old. Now, this is the reason why an 11-month-old child stands alone and can walk holding on to people or objects. Therefore, the installation of a gate at the top and bottom of any stairs in the house is crucial for the child's safety. Ang konsepto kasi natin dito is safety. Safety instructions. Nakuha ba yon? Of course you do. Now, before I further proceed, I would just like to congratulate all the test passers of the last board exam natin sa nursing. Congratulations, pinaghirapan nyo yan. Now, sa karamihan nga sa inyo ay kapag nakakapasa, bumabalik sa channel ko, nagko-comment at nagpapasalamat. Ako, na-appreciate ko po yun. Most of the work is really from you guys. I just help you with a little bit, but the effort, and I know how hard it is to prepare for the board, to wait for it even. is much more challenging compared to, preparation and taking the actual exam. The stress that it takes you to wait for the result is unbelievable. Trust me, I've been there, been done that. Kaya naman, ngayon nakapasa ka na, congratulations. I hope you don't stop learning and you still continue to, what's this, learn more and to enhance your skills, because if there's anything that I've learned from being a nurse for more than like a decade, that is nursing and health in general and people connection is something that constantly changing. There's new every day. There's new research based study. There's new practice that is being developed or being introduced to the area, into the nursing field, into the medical field. And I don't want you to stop learning and just be complacent about it. If anything, I want you to be more aggressive talaga, but be more, be more motivated in learning and pushing yourself to be the better you. Okay? All right. Now, oh, 'di ba? Parang nag-podcast na rin ako. 'Yun yung mga maririnig mo sa podcast ko, 'di ba? Napakalayo sa nursing, more on wisdom, motivational talk. So, kaya naman kung hindi ka pa nagsusubscribe sa akin o nagfa-follow sa aking podcast channel, panoorin mo na siya. Nandiyan yung link sa description box. Okay, Dok? Eto na talaga. Board exam type of question number 6. An 8-year-old girl is in second grade, and the parents decided to enroll her to a new school. While the child is focusing on adjusting to a new environment and peers, her grades suffer. The child's father severely punishes the child and forces her daughter to study after work. Ang lupit. The father does not allow also her daughter to play with other children. These data indicate to the nurse that this child is deprived of forming which formal phase of development? May clue na actually. Formal phase of development ng 8-year-old girl. Yung question actually is giving you clues. Hindi daw severely punish the child and forces her to, do her study after school. After school, aral ulit. Then the father does not allow her daughter to play with other children. Anong developmental phase ito na nade-deprive sa bata? Is it A, heterosexual relationships? Is it B, a love relationship with the father? C, a dependency relationship with the father? Or D, close relationship with peers? Your 5 seconds starts now. Time is up. What is your answer? Very good. Letter D, close relationship with peers. Why? Simple. In second grade, a child needs to form a close relationships with peers. Parte yon ng developmental phase ng isang 8-year-old girl. Period. Next, question number 7. A 5-year-old boy client is scheduled for hernia surgery. The nurse is preparing to do preoperative teaching with the child. The nurse should know that 5-year-old would. Ano ang typically gagawin ng isang 5-year-old prior to surgery or during perioperative care? Is it A, expect a simple yet logical explanation regarding the surgery? Is it B, ask many questions regarding the condition and the procedure? C, worry over the impending surgery? Or D, be uninterested in the upcoming surgery? Your 5 seconds starts now. So when you approach this type of question, may mga age group, lalo na sa pediatric nursing, maternal and child, you kind of like think, put yourself in a situation, kung hindi mo alam yung sasagot mo, yung dead end ka na, you kind of like put yourself in a situation where you are a 5-year-old boy or the client. And your age is 5 years old. How would you think? How would you think about it? Like, you kind of like put your foot or your feet on their shoe. All right. So the answer to this one, nurses, is letter B. Ask many questions regarding the condition and the procedure. Why? A 5-year-old is highly concerned with body integrity. The preschool age child normally asks many questions, and in a situation such as this, could be expected to ask even more. Alright, so letter B is the answer. Board exam type of question number 8. The 9-year-old client is admitted in the hospital for almost 1 week and is on bed rest. The child complains of being bored and it seems tiresome to stay on bed and doing nothing. What activity selected by the nurse would the child most likely find stimulating? Anong klaseng activity ang would likely stimulate a 9-year-old child? That is the question. Is it A, watching a video? Is it B, putting together a puzzle? Is it C, assembling handouts with the nurse for an upcoming staff development meeting? Or D, listening to a compact disc? Your 5 seconds starts now. Time is up. What is your answer? Very good. Letter C, assembling handouts with the nurse for an upcoming staff development meeting. Why? A 9-year-old enjoys working and feeling a sense of accomplishment. 9-year-old po ang age ng client mo. The school-age child also enjoys showing off, and doing something with the nurse on the pediatric unit would allow this. This activity also provides the school-age child a needed opportunity to interact with others in the absence of school and personal friends. Okay? Last 2 questions. Make this one count. Board exam type question number 9. The parent of a 16-year-old boy tells the nurse that his son is driving a motorbike very fast and with one hand. It is making me crazy. What would be the best explanation of the nurse to the behavior of the boy? Yun ang sitwasyon mo, driving me crazy. Best response mo or best explanation mo towards the behavior of the boy, 16-year-old boy. Now, A, the adolescent might have an unconscious death wish. Taray. B, the adolescent feels indestructible. C, the adolescent lacks life experience to realize how dangerous the behavior is. D, the adolescent has found a way to act out hostility toward the parent. Your 5 seconds starts now. Time is up. Mali mo naman nag-enjoy yung bagets. Kaya ang sagot mo dito is letter B. The adolescent feels indestructible. Diba? PBB teens to mga batang ito. So B nga po ang tamang sagot. Why? Adolescents do feel indestructible. And this is reflected in the many risk-taking behaviors. Diba during adolescent, dito yung mga stage na tinatawag nating mapupusok sila. Diba? Kaya, risk-taking behaviors. Ano pa ba yung mga risk-taking behaviors na ginawa mo during your, teenage? Yes. Diba? Kalma. Nagtetest lang tayo. Last questions na. If you made it this far of this video, baka naman mag-subscribe ka pang palaki charm para naman ganahan ako at maswertehin ka sa mga darating mong exam sa buhay. O, diba? Subscribe, hit the notification bell, and follow me on all my other social media accounts. I basically have everything. Just check the description box. Follow me on my Facebook, my TikToks, my Spotify, my Instagram. Okie doke. All right. Last question, board exam type of question number 10. An 8-month-old infant is admitted to the hospital due to diarrhea. The nurse caring for the client tells the mother to stay beside the infant while making assessment. Which of the following developmental milestones the infant has reached? Ano daw yun? Is it A, has a 3-word vocabulary? B, interacts with other infants? C, stands alone? D, recognizes but is fearful of strangers? Your 5 seconds starts now. Time is up, nurses. What is the answer? Very good. Recognizes but is fearful of strangers. Why? An 8-month-old infant both recognizes and is fearful of strangers. This developmental milestone is known as stranger anxiety. Alright, thank you so much you guys for watching. Please like, share, and subscribe to the channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan nyo nga po yung next upload natin, series of uploads natin for this week. So we have Wednesday and Friday coming up. So maraming salamat po. And tomorrow is I am going to upload our second episode of the podcast. Make sure na mag-follow ka na sa podcast ko and leave me a rating. If you want us to talk about anything about my podcast, please feel free to reach me out in all my social media accounts. Everything is at Neil Gave except for my TikTok account, which is Neil Gave Official. And I'm just so grateful, you guys. Thank you so much for all for all the love and support that I'm getting from you. Tulungan nyo na nga po kay pamalitan nyo na sa Radyong Sira, ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. And I'll see you again on a Wednesday. Have a good one.